My experience is nothing short of amazing, and I always think that I'm the lucky person because I get to watch families going from a feeling of fear and hopelessness to empowered and positive. There's nothing short of amazing when you get to help someone along in this journey, and the family understands that there's a whole team supporting them and their child. That's just awesome. There's nothing better than that.
My old professor got wonderful results in his kids with clefts by the time they were 18, but all through surgery they're having one operation after another. They often went to school and their nose was very flat. But when I got here to New York and started studying with Dr. McCarthy, we began to realize the kind of psychological problems these kids were having. Even if they looked great when they were 18, the damage to the developing ego was done. So what we did here was begin to evolve a system that put more of the focus, or essentially almost all of the focus, on the first year of life.
You know, we start out taking care of babies before they're even born. People are interviewing the parents when they know their child is going to be born with a cleft. So when the baby's born, Dr. Grayson and I, we get started trying to mold the segments of the cleft closer together and set the anatomy up so the surgeon has to do less surgery.
A child with a unilateral cleft lip often would have as many as 6 operations to treat that lip and that nose. Today we're trying to do that in just 1 operation by combining new techniques such as nasoalveolar molding, so we can get the patient looking very good and speaking normally in just a single operation, and then really just use our orthodontist for regular orthodontic care.
If we've all done our part correctly, and most of this problem is taken care of in the first year of life, the child doesn't feel that they're any different than anyone else. As they grow up, they have some orthodontics that maybe the other kids don't need. But this is a lot of kids get orthodontics these days. And hopefully all the psychological trauma that used to be absolutely de rigueur for kids with cleft lip and palate doesn't happen anymore.
We want to try to do as much as we can to help families and to make them feel good and to give them the positive reinforcement and help them get through this. And sometimes, no matter what anybody says, parents and patients have to feel the pain, and having them experience all these different medical things can sometimes be challenging and difficult.
I think we're helping the parents through the most traumatic thing that they've had happen in their lives. You know, they get on the internet, they look at some of these horrible pictures of how clefts have come out in the past, and the parents come in and they're in tears. You can see they're just holding back the depression. And by the time we finish our little slideshow as to how their kid is going to come out, you've really changed their whole attitude towards it. We kind of work them like a dog in the first 4 to 6 months of life with all this nasoalveolar molding. But they then get the payoff. They've been part of the treatment team that gets their own child better. It's very rewarding for them. I think it's a life-affirming experience.
The patients that stand out for me are the kids that we treated 24 years ago and are now really adults. It just seems extraordinary to me to have been part of their life from the time they were infants. This is a group of people who are very special for me, personally as a professional. The relationship with the parents, the kids, and their siblings, it's just really very much like a family. It's extraordinary.
Doctors McCarthy and Grayson and Cutting are world-famous individuals, and so I was lucky enough to train with them and then join the staff to work alongside. And I've had just a wonderful time. It's a big family here, and we're lucky enough to take care of some absolutely wonderful patients, so it's incredibly rewarding.
It's such a warm and giving team. They embraced me when I came in, and we work closely together every day, and I just feel a part of a family here, and it's been a lovely experience for me.
Being a doctor is not just the technical things. A lot of it is the interpersonal relationship, and we're not just healing a bunch of teeth or reconstructing a patient's smile. We're all trying to take care of the total package of the person.
I love taking care of this problem. It's one of the things in medicine where you can really, really make a difference. So many things in medicine, the patient's a little better, but you haven't really cured anything. I think most doctors spend a lot of their lives very frustrated. That is not true for me.